Us. We will begin today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. We are also joined this morning by Dr. James Childress, President and CEO of Meharry Medical College, Dr. Michael Caldwell, Metro's Public Health Director, and Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning. The Metropolitan Department of Public Health has received the report of a second fatality of a Davidson County resident due to complications from the coronavirus disease. The individual is a 67-year-old man who was hospitalized at the time and suffered from underlying health issues. On behalf of the entire city of Nashville, we extend our heartfelt condolences to his family and friends. Our community is facing a public health emergency, and I urge all of you to continue following the Safer at Home order to help flatten the curve of this disease. The evidence is clear. The decisions we make during each day will help save lives. And please, if the nature of your business outside your home is not absolutely essential, remain inside and practice social distancing to protect yourself and others. Dr. Jahangir and I have just returned from a meeting with Governor Bill Lee, State Health Commissioner Lisa Piercy, Brigadier General Scott Brower, and State Senator Farrell Hale. The state's COVID-19 Unified Command has been working hard to address our state's testing supplies and will be able to deliver swabs to Nashville by the end of the day today to help get our community assessment centers fully operational within 48 to 72 hours. I'm grateful to Governor Lee and to our partners at the state for collaborating with us to protect public health. And we look forward to receiving these testing supplies and opening the assessment centers to support our area hospitals and clinics. I am grateful to Dr. James Childress, President of Meharry Medical College, who is with us again this morning to provide his insight as an infectious disease expert on the coronavirus disease and our community's response. It has been a pleasure to hear Dr. Childress every day, and it makes us appreciate the incredible education that the medical students at Meharry are receiving. As Nashvillians, we find ourselves facing two historic crises, the March 3rd tornado and now the coronavirus. For those of you in need of financial relief, I urge you to visit covid19.nashville.gov to find a link to the COVID-19 Response Fund and information about how to obtain financial, food, housing, unemployment, tax filing, and utility payment assistance. Since March 3rd, Nashvillians across our city have engaged in acts of kindness, compassion, and generosity from neighbor to neighbor and between strangers who have formed friendships in the face of unprecedented challenge. While we remain safe at home to eradicate the coronavirus and steadfast in our commitment to help those displaced by the storm, to help them recover and rebuild, we can also find strength in each other's stories of hope and courage. I encourage all of you to share your own stories by using the hashtag #NashvilleStrongStory on social media and to visit covid19.nashville.gov to learn more about ways to help your fellow Nashvillians at this time. And now I'll turn it over to Dr. Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning. Here is the latest update for Nashville. We now have a total of 312 confirmed cases. As Mayor Cooper just said, yesterday we had our second death as a result of the COVID-19 virus, a 67-year-old gentleman with underlying health conditions. I too want to express our sympathies to his family and friends. This is the second Nashville resident who passed away as a result of this virus, and it is a reminder that this virus can be fatal, and we have to take it very seriously. We have had an increase of 20 cases in the past 24 hours. The patients range in age from 2 months old to 84 years old. Of the confirmed cases, 12 are currently hospitalized. 244 cases are self-isolating at home and have mild and manageable symptoms, and 54 people who were confirmed cases have recovered and are now cleared. In addition, there have been more than 3,500 COVID-19 tests conducted for Nashville-Davidson County residents. As the mayor just said, this morning Governor Lee committed to getting us swabs and testing kits. And as we speak, the state's Unified Command is getting the test supplies for us. As soon as the meeting was completed with the governor, Director Chief Swan and I immediately mobilized our team to get our community assessment centers open as soon as we get the supplies. We will have 2 sites open on Monday morning. The first 2 centers will be at Nissan Stadium parking lot and on Murfreesboro Pike at the old Kmart location. In addition, Meharry Medical College is opening an assessment site in conjunction with us. These centers will augment the current healthcare system in Nashville and supplement the assessments they are doing for our residents. I want to express my sincere thanks to the Governor, Commissioner Piercy, Commissioner McWhorter, and the entire leadership of the Unified Command, along with our team of Nashville hospitals and medical students on medical schools on getting these sites launched. In addition, we still need your help. If you're a healthcare professional or healthcare facility with supplies you are not using, then please donate them. We will need them for our assessment centers and for our first responders. Go to our covid19.nashville.gov to see what we need. If you want to donate smaller items, then please bring them to the Community Resource Center on Omohundra Place. It will be open Mondays through Saturdays from 10 a.m. to 4 p.m. And thank you so much for all of your response so far for our request for items. Additionally, yesterday we opened our temporary shelter facilities for our homeless residents at the fairgrounds. Around 50 people were housed there last night, and we will host more over the coming days. They are in a safe place with cots, bedding, laundry facilities, food and entertainment options, and where social distancing is encouraged. We also have a shelter ready for those who have been tested to self-isolate safely as they await results. And a third facility will open soon that will be used if someone tests positive so they can self-isolate and recover. I appreciate the work of the Metro government employees, nonprofits, and business community who have stepped up to help our fellow Nashvillians who need help. In addition to this, the Metro Public Health Department continues to operate a hotline to be a resource for our residents. Health professionals are there to answer your questions about COVID-19. Call 615-862-7777. This COVID-19 information line is open from 7 a.m. to 7 p.m. 7 days a week, and you can get the latest information on our website, covid19.nashville.gov. Finally, this is our 5th day in the Safer at Home order. Now, I know you may be getting stir crazy, and I know you want to get out, but please remember to stay focused and stay at home unless it's absolutely necessary. It's fine to get out and get some fresh air, get some exercise, but please remember to stay 6 feet from each other. Right now, the best way to flatten the curve is the best way to save lives, and you can help save lives. We are all truly in this together, and together we will get through this. I appreciate what everyone is doing, and now I will turn it over to Dr. James Childress, President and CEO of Meharry Medical College.
Good morning, Nashville. I would first like to thank the mayor for giving me a chance to be with you to speak about the science that underpins the decisions that are being made and to help understand the pandemic. And as we approach the end of the first week of the Safer at Home strategy, I wanted to remind you of the recommendations of the CDC of what to do when symptoms occur while you're self-isolating at home. As a city, we've done really well, and this will definitely help us flatten the curve so our hospitals can deal with the expected increase in hospitalizations. This COVID-19 pandemic has occurred at a time when many are suffering from the flu and colds. So it's very important, since these have similarities to COVID-19, that we reserve resources to deal with the pandemic and make sure we're distinguishing between those who have the flu and colds and those who truly have COVID-19. The first thing I must say is that if you have serious or extreme symptoms like shortness of breath, discoloration of the lips or face turning blue, or you have pain in your chest or pressure in your chest, by all means, get emergency assistance as soon as possible. The most common symptoms of COVID-19 disease are dry cough, fever, and shortness of breath. Since most people who get the virus will have a mild illness and they can recover at home, we urge you to remain at home unless you need medical assistance. Before visiting an emergency room, a doctor's office, or clinic, you should call ahead and speak with the healthcare provider, and they will give you advice as to whether or not you really need to come in and be seen. They will determine what actions to take and give you advice and guidance. And when you visit a healthcare facility, don't be surprised that you're going to be screened before you enter, and that's being done to protect the staff and the other patients from possibly getting COVID-19. You should also avoid public transportation of any kind, and if you do have to go out, as the director said, please observe social distancing and take precautions not to transmit the virus. If you live with someone who has COVID-19 or possibly have it, you need to take specific steps within your home to prevent transmission to other family members. As much as possible, the COVID-19 positive person should avoid close contact with the people they're living with, and if at all possible, wear a mask. Household members should stay in another room, if that's possible, or be separated from the patient as much as possible. They should also use a separate bedroom and bathroom, if that is feasible and possible. And by all means, all the high-touch surfaces should be cleaned at least once a day, preferably twice a day. These include countertops, tabletops, doorknobs, bathroom fixtures, toilets, phones, and bedside tables, keyboards, and tablets. Also, clean and disinfect any surfaces you think might have blood, stool, or bodily fluids on them. Household items should not be shared with the patient. These include dishes, cups, drinking glasses, eating utensils, towels, bedding, and other items. And after the patient uses these items, they should be thoroughly washed and cleaned. You should wash your hands frequently with soap and water, and you've heard, and it's really true, that needs to be for at least 20 seconds using a good soap. Or if you don't have the ability to do that, use a hand sanitizer that contains alcohol. And in that case, you want to cover all the surfaces of your hands and rub them until they're completely dry to make sure it's effective. And as much as possible, please avoid touching your T-zone, which, as a reminder, are the eyes, the nose, and the mouth. And if you can't break that habit, by all means, keep your hands clean. We recognize that some of us live in settings whereby social distancing within the home or the apartment will be difficult. And for those persons, we ask you to call the COVID-19 hotline to get advice and assistance. That number, as you heard, once again, is 615-862-7777. If you live with someone and you test positive for COVID-19, and that person is one of the high-risk categories, if at all possible, arrangements should be made for that person or the COVID-19 positive person to live in separate accommodations. Now, if that's not possible, by all means, please adhere to the previous recommendations strictly so that that person does not get the disease. And as a reminder, high-risk persons include those who are 65 or older, especially if they have an underlying condition like heart disease. Others in this category includes those living with HIV, those who've had a recent organ transplant, those with certain types of cancer or being treated for cancer, those who have a blood or bone marrow cancer such as leukemia, those who have severe lung conditions like cystic fibrosis or asthma. If you have a condition that makes it more likely for you to get infections, that's a high-risk category as well. And if you take medicines to weaken your immune system because you have an autoimmune disease such as rheumatoid arthritis or multiple sclerosis, you are also in a high-risk category. And the CDC highly recommends that pregnant women avoid as much as possible getting the infection. Yesterday, our country took on the dubious distinction of having more COVID-19 cases than any other country in the world. The science and the data predicts to us that that is probably a gross underestimate of the total number because the amount of testing being done in the United States is relatively low. You've heard that here in Nashville, the assessments for COVID-19 will begin shortly. And the same science and data that led to the decision to ask you to stay at home also predicts that when we start doing this, the number of cases will increase dramatically. It might be tempting to conclude that asking the citizens of Nashville to shelter at home, disrupting lives, and dragging the economy to a crawl may have been a waste of effort and time. It has not been. The science shows us that there are many persons out there living with the virus. They're not aware of that. And as soon as we start the testing, it'll become clear that there are a lot of individuals who are carrying the COVID-19 disease. We need to do the testing because it's essential for public health officials to have good data to make decisions about next steps so we can all get back to a new normal. So Nashville, we're blessed to have a healthcare infrastructure that's second to none, and they're doing their part to make sure we can get through this. We're also blessed around the world to have some amazing scientists who are working around the clock to find an answer, and they will. Our job is fairly straightforward, and that is to remain safely at home. And consider this. Would we prefer to wake up to a headline that millions of Americans have filed unemployment claims, or that millions of Americans have died from COVID-19 disease? That might sound like hyperbole, but that is the stark reality we're faced with. And clearly the latter is unthinkable. So let us continue to do our part and remain safer at home. And remember, this virus needs a vector to transmit itself from one person to another, and we are its vector. So the goal is to not be a vector. So Nashville, please don't be a vector, and we're going to get through this. Thank you again, and thank you, Mayor Cooper.
Thank you, Dr. Childress. We will now start the Q&A portion of today's briefing. I want to extend a special welcome to 4 MNPS high school and middle school journalists who have joined us this morning to ask questions and help inform their fellow students at Hillsborough High School, Hillwood High School, and Rose Park Magnet Math and Science Middle School. I will announce your name out loud from the podium, at which point you will be unmuted and may proceed by asking your question over the air. We will start with Abby with the Hillsborough Globe.
Thank you, Mayor Cooper, for taking my question. In addition to digital tools and NPT resources, how can high school students become more engaged and responsible for their own education? Specifically, how can you remain competitive with surrounding counties and independent schools with regards to the ACT and scholarship application?
Mayor Cooper.
Thank you, Abby, for that question. And I do want to just brag on you a little bit, having been offered an internship with the New York Times for the summer, one of only 30 nationwide. And that's a great question. First, everybody needs to understand what a strange time this is. There are a lot of things, however, that MNPS students can do to keep learning, and also to impress college admissions officers. If you visit mnps.org/digital tools, you'll find a whole set of resources and suggestions for MNPS students. Now, I love history books myself. Limitless Library is another great way to get books. If you don't have internet at home, but you do have a phone, you can use your phone to access these services. And there's also information on that website about how to get free or reduced price internet at home. There are also opportunities to engage with the community and help. Of course, everybody needs to practice social distancing. But reporting for the Hillsborough Globe, participating in events like this, calling to check in on your neighbors, taking care of family members, and reminding your friends of the importance of staying at home to avoid becoming a vector. All these things are important. And believe me, I do think college admission counselors will read about your efforts with interest in your applications next year. Thank you.
Next, we have Annalise with Topper News Network.
All right, I would like to start off by thanking Mayor Cooper for taking my question. Many students my age don't seem to understand or take seriously the drastic circumstances that the pandemic has brought. How many or what percentage of the demographic of 15 to 25-year-olds have been identified as having COVID-19, and how can we reinforce the importance of sheltering at home as a way of contributing to slowing the spread of the virus?
Dr. Jahangir, would you like to take that question?
Annalise, thank you so much. I have to say I'm an MNPS graduate from Martin Luther King Magnet, so this is actually a great opportunity to be able to speak to you. You bring up a really important question about individuals that are 15 to 25 years old and why you should even care about this, right? You are correct in saying that the people who are hospitalized are typically the older age range, over 60, so forth. Less than 2% of individuals who are hospitalized are in the 15 to 25-year-old range. But as Dr. Childress has mentioned throughout the week, that doesn't make you immune from being a vector or carrying this virus. So you can get infected, you may just feel a little lousy. You go home, you visit with your parents, you visit with your grandparents, you visit with perhaps a sibling that has underlying medical conditions, and you transmit the virus to them, and it can kill them. So this is why it's really, really, really important that 15 to 25-year-olds, or even or a little bit older than that, recognize that this is no joke. We're fortunate when you're younger that you're not as impacted by this as far as critically. But don't fool yourself. You can be a vector and you can kill a loved one. So please just use the social distancing protocols. Thank you.
Sophia at Rose Park Magnet.
Thank you for taking my question, Mr. Cooper. My name is Sophia Costin, and I'm from Rose Park Middle, and I would like to know how Davidson County can guarantee the safety of students when we return to school.
Mayor Cooper.
Well, thank you, Sophia. And let's extend the question, not only how can we guarantee the safety of students, but why are states and cities often different in their response in guaranteeing their student safety? We are not going to take any chances with our kids' health. Kids will go back to school only when the public health department says it's safe for them to do that. And that's going to be using the best scientific knowledge to make that decision. Now, one of the reasons we're seeing different responses to this from state to state is that we have a federal system of government that entrusts governors and city leaders with a lot of important decisions. Some places have had more documented infections than others, and that's led governors and mayors to make different decisions. Here in Nashville, we are listening carefully to the medical experts and doing everything we can to make sure that people are safe. So we will not be going back until it is safe to do that, and safe in our city. And we're going to depend on medical authorities such as Vanderbilt and St. Thomas to help us make that decision. Thank you.
And our last student journalist question comes from Anna at Rose Park Middle.
Thank you, Mayor Cooper, for taking my question. I would like to ask, what is the best method to handle the rising unemployment numbers, as so many businesses are classified as non-essential in Davidson County?
Well, thank you, Anna, for that question. The best solution to this is to flatten the curve. Unemployment is very hard. We need to shorten the time that our economy, frankly, is frozen while we get through the virus. So flattening the curve is by washing our hands, staying home to the extent possible, and by not gathering in groups in order to make sure that our hospitals, frankly, are not overwhelmed. and can focus on taking care of the sickest patients. We're very fortunate in Nashville to have many great hospitals and hospital systems here, and they're going to work hard and are working hard to make sure that we are prepared. Now, we're also working hard with community partners here in Nashville to provide financial assistance to those who have lost their jobs and their incomes because of the coronavirus. One of these resources is the COVID-19 Response Fund, which offers financial, food, housing, and utility bill assistance. And you can read more about that at covid19.nashville.gov. But frankly, cities like ourselves are eagerly awaiting federal funds to provide direct support for individuals and small businesses, because the federal government has a lot more resources than we do at the local level. There is currently, right now, a federal aid package awaiting a vote at the U.S. House of Representatives, which would require then a signature by the president. We don't know quite what is in that bill for our city and our residents, but we're hopeful that it will help us get back on our feet as quickly as possible and have as an abrupt restart to our economy as there was in the current cessation. Thank you.
Thank you again to our student journalists for joining us this morning, and to the journalism faculty at Hillsborough High School, Hillwood High School, and Rose Park Middle. We'll continue with Stephen Elliott.
Hey, Mayor Cooper, hope you're doing well. Thanks for taking the time. I wanted to ask you if you could describe the conversations you're having about the budget right now, as far as, new revenue projections, and whether you think a property tax increase might be necessary.
Mayor Cooper.
Thank you, Stephen. Well, it's a daily challenge as revenue estimates change, and we do not know what the federal package is that's going to come to the city. We're hopeful that it's quite large and will alleviate some of our financing problems. As is well known, the city already had a problem before the tornado or before the virus. We have the lowest cash of any city in the country, really, and we have the highest debt per capita, really, of any city. That combination was hard, but also we had a habit of kind of counting phantom cash, phantom revenue as revenue. That has to be redone, and that has to be replaced with actual revenue. In this challenge, everything has to be on the table. Yesterday we announced a hiring freeze, a travel freeze, and we're going to have to look carefully at all of our capital spending, because our commitment in this crisis is to get the city through it, is to get our employees through it, and to serve the people. Everything has to be looked at to make sure that we get that done. It's going to be a lot easier if we flatten the curve and then have a shorter period of time that businesses, individuals, and frankly the city government is without the revenue of the economy. So let's get the curve flattened, commit to our city, and get us through this. And this is not a time where we can, frankly, go ahead and fix issues that we have had with the city and the city services. Now is the time to commit to the city that we're going to be there for you. This is a got-to moment in Nashville history. We've got to, and we will.
Jeremy Finley at WSMV.
Thank you for taking our questions and also for including the student journalists today. Appreciate that. We're hearing a lot of complaints from people that are waiting well beyond 5 days to get their test results. So that leads to the question, the numbers that you all are providing on a daily basis, if we have such a backlog of people waiting to get their test results, how do we know that the numbers that are then being provided to the public are an actual representation of the cases in the city?
Dr. Jungir.
Thank you so much. Short answer is we provide you with the information that we obtain as quickly as we in the Department of Health, Public Health Department, get that information. So I hear what you're saying regarding backlog of testing, and that is really just a supply and demand issue and what the labs can do. But as quickly as we get that information, we report it. Now, with that being said, I understand the concern of, well, maybe we don't have a full understanding of the scope of this in our city. Well, I think because of that, even more of a reason why we need to highlight the social distancing, the safer at home order, because I think you're right. I've been saying for days we're not on the downtrend here, and so as more results come in, as more people are tested, as you're going to see the numbers go up. But I think as models have shown, the quicker people socially distance, the quicker people adhere to the safer at home type measures, that's the best way to get over this. But I commit to you complete transparency. As quickly as we have data, we share it. So thank you.
We have time for 3 more questions. Brett Kelman, Peter White, and then Nancy Amon. So Brett Kelman at the Tennessean.
Hi, good morning, everyone. Again, honored to be on the call with the next generation of journalists. Very cool that you guys included them. I have a 2-part question about the assessment centers. Yesterday, there was a statement there were 3 assessment centers ready to go: Nissan, Murfreesboro Pike, and an undisclosed location. Now there are Nissan, Murfreesboro Park, and Meharry. I'm uncertain if Meharry is the 3rd previously undisclosed location, or if there is still another one out there in the works. And then secondly, you guys have been trying to get testing supplies for these assessment centers for at least a week, and now you've got them. And I'm curious sort of what changed in the last 24 hours that is going to allow these centers to open.
So Brett, thank you so much. The 3rd location was the Meharry location. We just we're working on some details, so that was the 3rd location. They will also have the capacity of I believe around 2 or 3 tents, which will add a great resource to our community. Regarding what changed, we had a really productive meeting with Unified Command. Literally, that just ended about 25 minutes prior to the beginning of this press conference, and we're working together. And the governor saw what we were doing, recognizes why that's important, and he and the entire Unified Command committed to getting the swabs and pull the full resources of the state to do so. So I'm grateful for them, and we're moving forward. Thank you.
Peter White at the Tribune.
Hello, can you hear me?
Yes, Mr. White.
Hello?
Mr. White?
Hey, I have a question about the fairgrounds. Could you just run to somebody who knows about that? Just run through the 3 possibilities. There were, you have 50 people there now, and then there were 2 other categories. One where people, if they're showing symptoms, can self-isolate, and then there was a 3rd category. I suppose that would be if people are tested and they're positive. Do I have that right?
Yes, Dr. Jungir.
In short answer is yes. We have a place for unhoused individuals who are well, who are not showing signs or symptoms, who want to practice social distancing and safe hygiene practices. The 2nd location, so that 1st location is where we had 50 people last night. 2nd location is for individuals who may have shown one of the symptoms that requires a test, and they obtained a test where somebody who has a place to go to will go home and self-isolate. This facility will then allow for that individual to self-isolate safely while awaiting results. And then the 3rd location is for individuals who have tested positive, and where typically somebody who is housed would go home and maybe spend 14 days or so in quarantine. This would allow that individual a safe place to go.
And we'll close with Nancy Amons.
Hi, thanks for taking my questions today. For the mayor, I have some budget questions. How far down is revenue? And you talked about having everything is on the table. Are you looking at raising taxes, furloughing employees, refinancing the debt, any or all of the above?
Mayor Cooper.
Thank you, Nancy. We don't know currently for sure how far down our revenue is. You can do a back of the envelope calculation and look at our sales tax collections and then assume that you're going to have the next quarter of which you're going to have very few. Well, that does quickly add more than $100 million. Now, the city's requirement is to have a balanced budget. We don't have the luxury that the federal government does. We don't have the cash resources that the state does. So when you're looking at solutions to this, everything has to be on the table. And in time, we are hoping the city had strategies in the past, including refinancing debt. Perhaps that is an opportunity for us. Of course, financial markets have been troubled, and you cannot predict with any certainty about whether that's one of your tools, but we're going to need all the tools, and we're going to have to understand what our first commitment has to be. The first commitment has to be to help our employees and the city get through this. And we're going to think of the city, frankly, as the crisis response, and then we look forward to having the post-crisis response, which is back to building a great city. But for right now, everything is going to have to be looked at. The size of the federal package, it's unclear right now, but it's estimated to be very significant. It's going to be very hard to make plans not knowing what the specifics of that package is. Out of several $1 trillion, a lot will come to Nashville, a lot will come to businesses and to individuals, and a lot, we hope, will come to the city to help tide us over the missing sales tax money that is probably our greatest single direct problem. And we're learning together as a city that sales tax revenue is not necessarily recurring revenue. It can go down. That's just an additional complexity for city budgets going forward. Super hard to do it, though, with the cash reserves that we have had on our balance sheet. As is well known and documented over time, we let them get too far down. So this is not only a rainy day, this is a stormy season. But we're going to get through it. And we're going to get through it by using every tool that we can to support our citizens.
Thank you, everyone. We will make a recording of this morning's broadcast available later this afternoon. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.